if I ran the zoo, this is what I'd do. When I say zoo, I'm just kidding. I'm talking about running a hospital. There's a lot of things in modern hospitals that could be improved. First of all, more bathrooms. I've never been in a hospital that didn't need a lot more bathrooms, and they should be big bathrooms because a lot of patients are in a wheelchair, they're barely mobile, so they need a bigger bathroom to maneuver. Wider hallways. Anybody that spent a lot of time in hospitals, there's always, during the busy times of the day, far too crowded pathways in the hallway, and you end up walking behind, somebody who goes really slow when you got a lot of work you have to do. And then when you're pushing patients through, or when somebody's really sick and you have to go fast, they all would benefit from bigger hallways. Okay, the ICU rooms, of course, should be bigger. More space for doing procedures. It's often very awkward to do a procedure in an ICU patient room. You should reduce the number of things that go bing, just because they're so noisy, a lot of these ICU rooms, the patient, it's difficult for them to sleep. A patient needs to sleep to get healed. I just thought of this from I thought of the Dr. Seuss book, If I Ran the Zoo. There should be staff lounges for conversations between doctors. A lot of the public doesn't realize it. It thinks doctors talk to each other and they know each other and they converse about their patients to help the patients. The reality is most doctors are working their tails off in some isolated area in a hospital, and they have almost zero conversation with other doctors, which limits their knowledge because the more doctors talk to each other, the better the outcomes are for the patients. I can tell you, for example, when I did a lot of imaging-guided surgery, I still do some, but not much as I used to, the most important prognostic factor for any type of slightly unusual, atypical procedure was that the doctors had a good conversation about what exactly is the problem, what exactly needs to be done. Because without that conversation, a lot of times something gets lost in the cracks and it leads to less than an optimal outcome. I've done many thousands and thousands and thousands of procedures. I have a lot of experience in saying that. Okay, doctors, when they talk to each other, they can learn a lot. Because a lot of times some specialist will know something from all their experience that they could share with somebody, and that's valuable. There should be interdisciplinary conferences. Doctors hardly ever talk to people from other services. They'll do it sometimes, but the more they do it, the better. For example, the more I talk to doctors from other fields, the more I have a chance to sort of pick their brain, if you will, to get what they know about certain things that are, obscure unless you have a lot of direct experience with it. So in my years of being a doctor, over 30 of them, I can tell you one of the most valuable things is having a chance to speak to docs from other fields where they have access to info that's harder for me to obtain. There should be a Cure of the Month conference. People laugh, but in reality, most modern doctors, they've never seen a cure, or very rarely have they ever seen a cure. Like for obesity, they'll have seen somebody lose weight after bariatric surgery, but they probably have zero experience where understanding that a patient can really lose weight that they've seen in their own clinical practice. They've never seen any big cure from hypertension, diabetes, coronary artery disease, or autoimmune disease. Drugs don't cure those diseases. The patient keeps taking the drugs for life, okay? And it can maybe slow things down a little bit in some instances, but you go into the vegan world, okay, and you see people cured all over the place, left and right. There's no comparison. You go into hospital, most hospitals have terrible food. They have terrible food in their cafeterias and terrible food in their vending machines and terrible food served to the patients, okay? They should have at least the option of a vegan diet in the cafeteria, in the patient's meal plans, etc. Doctors should be taught about nutrition. They don't learn it at all in med school or residency. It's completely, and it's not in any of the books. You could read a chapter on coronary artery disease and diabetes, and there'll be no useful information about diabetes or heart disease. They pretend it doesn't matter. The books are designed to get them to learn how to sell drugs. In my opinion, doctors should only work 4 days a week or less. The reason I say that is most doctors are overworked and sleep deprived, and they don't read. It's very rare to talk to a doctor about a paper they've read, okay, or even a book outside of their conventional textbooks. Their boards exams are based on the conventional textbooks, and the conventional textbooks have nothing about nutrition, epidemiology, toxicology, very little on stress management, psychology of healing, how to improve blood flow, all this basic stuff. So they don't know it. They simply don't know. They don't know how to improve blood flow. They don't know how to improve healing. They don't know the absolute most basic stuff. It's a joke. I mean, you can even ask yourself, is conventional medicine legitimate? For a lot of fields, it's good, like emergency room, for example. But for a lot of other fields, they really don't know what causes the disease, even though it's been known for over 50 to 100 years. They don't know what the best treatment is. All they know is prescribe the recommended drug, because that's always a safe thing to do. If you prescribe the recommended drug, match the ill to the pill, send a bill, You get paid, and no matter what happens to the patient, you can't get sued or anything because you followed the standard of care. I think they should encourage the lazy-ass staff to take the stairs when possible and to eat healthy and to set an example of fitness for the health of patients. You walk into any Western hospital, and you're going to see all these fat nurses and fat doctors, and the person, if you go to health club, the people that work at a health club, they're usually pretty fit. They have a sense of our staff should be fit. This is a health fitness club. Okay, but you go into a hospital, you'll see tons and tons of fat staff, which is an indicator that they don't know what they're doing. If you're fat, you're sick. If you're fat, you're pre-diabetic, and you're, if not already, diabetic and hypertensive, headed towards all the other Western diseases, coronary artery disease, impotence, cerebral vascular disease, cognitive impairment, etc. So that should be something that they talk about. The staff should all have some knowledge of healthy diet, exercise, etc. There should be a chapel with art and music, and performers often invited. They sort of increase the morale. You see a spark of life, access to the transcendent, paintings that they could look at. I would ideally have paintings in the hallways, but some people might make a fuss about that. Just a print, something to see that's positive, upbeat, inspiring. They should have the ability to open their windows. Here's an old-fashioned hospital. I show you this because notice how the hallways are kind of narrow and there's lots of windows. This might be a corner room here. There'll be windows on each side. Also, in the old days, you could open up the windows and get some fresh air in there to ventilate the room. You could also get sunshine. Here's a spot where the patients can get some sunshine on a porch. I would actually have big patios, one for the patients, another one for the doctors. I wouldn't have the doctors in the same area as all the patients because what happens to a lot of doctors, if they've got a busy practice, they know tons of these patients and they'll never be able to walk across the room without having a whole bunch of conversations, so they can't get their work done. If they want to walk in the patient area, that's fine, but they should have a little spot where they can go and not, and be allowed to just rest and relax. Okay, but the reason why I think they should only work 4 days a week is because they don't read. They really don't read. And there should be conferences about nutrition, about epidemiology, about toxicology. They should respect the effect of religion that dramatically improves health. Okay, so what else? I think that's about it for now. All I can think of. Hope that was helpful.